Welcome back to the channel of Boulder Pain Relief Massage. This is Lau Kemper, and this is a great question. I get this question a lot, and I like talking about it. So we're going to take a few minutes just to talk about a very common question that many massage therapists get, and there's a lot of confusion around this. One of the most common areas people ask this is around the neck and shoulders, but this is true everywhere in the body. And what's the question? The question is, what is the difference between a knot and a trigger point? What is a knot, etc.? What is that kind of mass or thing that I feel in my shoulder or tissue? And a lot of people call them knots, right? That's gotten a lot of attention and it's become kind of normalized. I don't use the term knots when I work on people. And the way that I like to talk about this, especially with my background and where I come from with my training in Seattle, we're trying to be very specific about what we're talking within the body so that we can be very effective when we're working on it, and also empower people so they have a better understanding about what's happening with their body so that they have the best chances for it to feel as good as possible, as often as possible. And so an old mentor of mine, I always like to give him credit because I had a mentor in Washington who was a Bering sea crab fisherman, an incredible man. He knew a lot about engineering and boats and engines and machines, and he was the most proficient person I've ever seen in my life at tying knots. If you've ever been around a sailor or someone who spent time on the water, you can quickly see some skill as to how they handle ropes or lines. And so, this mentor, he had a great phrase for this, and I like to tell it to people when they say, "Is that a knot?" And he would tell me, he said, Lau, that's not a knot. It's not a knot if you can't untie it. It's just called a mess. And that's particularly as it relates to, tying lines, working with heavy loads and working with ropes and things like that. A good knot by definition ties and unties really well. That's what makes it a really good knot. If it's just a bundle of rope and line or climbing rope, it's kind of just a mess. So in tissue, really what we're talking about, there's kind of two key terms for this. But what's the difference between a knot and a trigger point? So first, a knot is not a knot. It's actually grouped muscle fibers. And the example I often give to my clients and patients, this is a simplified version. We have an enormous amount of muscle fibers in our body. By some estimates, the bicep brachii has over 100,000. There's a lot in the body. So we're talking about a lot of structures that are working together. And this is the example that I like to give. So when we have areas in the tissue where it really feels bound, where it feels like there's something in there that most people would say, is that a knot? We're talking about adhesions. In Europe, they would often talk about these as lesions, but they're kind of the same thing. Lesions are adhesions, where in healthy muscle fibers, and hopefully you've experienced this, each of the fibers is doing its job. So if my fingers, each of these are muscle fibers, if I'm moving these, let's say it's a bicep or it's a quad muscle or it's a trapezius muscle, ideally each of these fibers are doing their own job. They're slowly grabbing onto the attachments and helping feel like we have very nuanced, kind of calibrated motion in a healthy functioning tissue. What tends to happen in kind of the process as it begins is these fibers, let's say we have muscle memory or just trained muscle patterns, where we start to have some of these fibers start to group. So these three fingers here have started to group, and then these ones are still kind of free. But this is where we often feel it kind of feels ropey in the tissue, kind of feels like there's a string or a line for some people. That's what this is. This is when these fibers have become a bit bound to each other, which for a long time can be very functional. This is great for training. It's what we try and build to be very quick and powerful. But left unchecked, these fibers can start to all become grouped. And if this is happening in an ecosystem of a muscle compartment, a joint, an area where we're feeling these fibers really grab, especially when it's really well developed and it's become chronic. These are adhesions where the collagen and the tissue has started to repair and it feels like there's a thing in there. Rather than there's a lot of tissue that's moving and gliding well around itself, it's become matted, adhered, and bound to itself. And so that's what we're talking about when people often say, what is a knot? And so what's the difference between a knot and a trigger point? So a knot or adhesion and a trigger point are different. A trigger point by definition is when we press somewhere in the tissue, and that creates a non-local or sensation is felt somewhere else. So I don't work on trigger points per se, somewhat outdated as far as how they were treated as far as applying static pressure. I do a lot of movement in my treatments as far as mobilizing limbs, assessing and treating simultaneously. And so a trigger point is different. It's often when we press somewhere and we feel that feeling somewhere else in a predictable fashion. So that's more of a trigger point. So hopefully this helps you understand a little bit. And if you're feeling some of those areas that we'd say is that a knot or trigger point, starting to think about them as grouped fibers will really help move the needle for you. So figuring out what is going on in there can sometimes require the help of an expert, PT, massage therapist, and getting them to help you understand where those areas are most bound, what movement patterns are involved in those, and then what to do about it. So I love working on those. It's a great question. And if you haven't liked or subscribed already, please do. Welcome to the channel, and I'll be answering more questions as they come along. Take care.